emergency department, our emergency team consists of specialist nurses, doctors, clerical and security staff who aim to provide you with the highest quality care as efficiently as possible. We recognise that when you're sick, injured or worried, every minute seems like an hour, but we do not want to rush the steps we take to diagnose and treat our patients, and we trust that you understand that doing everything for you and other emergency department patients can take a little time. You will be treated as soon as possible, but you may find that someone who arrives in the emergency department after you may be seen before you if they need treatment more urgently. People are seen depending on how urgently their condition needs treatment, rather than in the order of presentation. This is a part of the triage process. On arrival, the first thing you will do is to see a specialist emergency nurse called the triage nurse. The specially trained triage nurse will do a quick assessment to determine the severity of your condition. This system allows patients with urgent or life-threatening problems to be seen first. In general, the triage system places patients into 5 categories: immediate, life-threatening, for example, a cardiac arrest or a major car accident. These patients are attended to immediately. Their life depends on rapid treatment by the emergency department team. Emergency, potentially life-threatening, for example, chest pain or severe asthma. These patients have an illness or injury with the potential to become life-threatening. Our goal is to see these patients within 10 minutes. Urgent, not life-threatening, such as severe abdominal pain, a broken arm or concussion. While this category acknowledges the patient is very unwell, the illness or injury is not life-threatening. Our goal is to see this triage category patient within 30 minutes. Semi-urgent, such as a painful sprain or fever. Our goal is to see this triage category patient within 1 hour. Non-urgent, such as minor lacerations or cuts. Our goal is to see this triage category patient within 2 hours. While this wait can be uncomfortable, the condition is unlikely to get worse if waiting is necessary. This system allows for the patients with the greatest urgency to be seen as a priority. While our goals are to see every patient within the triage timeframes, this cannot always be the case. Emergency departments can become very busy with little or no warning. For example, staff may have to rush to help a patient suffering from a life-threatening emergency. This could involve 5 or 6 staff members. Circumstances such as this impact on how long you may need to wait. We will, however, try and keep you up to date while you wait. It's important to note that even ambulance patients do not get priority. They also go through this system. After seeing the triage nurse, you may be asked to wait in the waiting room. How long you wait depends on the number of patients whose condition is more serious than yours, and also how busy the department is. Just because the waiting area appears quiet, this does not mean the emergency department is not busy. We understand that waiting can be frustrating, especially when you don't feel well or are worried. We will do everything we can to keep your wait to a minimum and keep you as comfortable as possible. While you wait, if you have any concerns or if you feel your condition changes, please talk to the triage nurse. We ask that you do not eat or drink before being seen by a doctor, as you may need tests or procedures that require you not to eat or drink beforehand. In the treatment area, you will be seen by other emergency department specialists who will ask you some questions and examine you, discuss your problem, and tell you about treatments or tests that might be required. You are encouraged to ask questions about your illness and your treatment. If necessary, you may need to be admitted to the hospital. When tests or investigations are required, there may be delays in your progress through the department. Time is required to gather specimens, transport them to the laboratory, perform tests and quality controls, and then get results back to your treating doctor. Please be patient through this time and when other tests such as X-rays are being organised and performed. If you feel delays are excessive, please talk to the medical or nursing staff. Sometimes doctors or other specialists not working in the emergency department may need to be called in to see you. This may take some time. Ongoing care will continue in the emergency department while you wait. To help the staff assess and treat you properly, please inform them of medications you're taking, allergies you may have, your medical history, if you are pregnant or have other special needs, any recent visits overseas. Having family or friends with you is important. However, for safety reasons, only 1 or 2 visitors are allowed in the emergency department at one time. We advise you to ask a friend or relative to look after your valuables while you're being treated in the emergency department. We care for our patients. We also care for our staff. The emergency department has a code of behaviour to ensure a safe and friendly environment for everyone. No acts of physical violence, intimidation, swearing or verbal abuse towards another patient, relative or staff member will be tolerated. If this type of behaviour is displayed, you will be asked to leave by the staff, security or the police. If possible, you will go home after treatment. When you are discharged, you will be given information about follow-up care. This may be instruction sheets, medications or scripts, appointments for further tests, outpatient appointments, a referral letter for your local doctor. Please make sure that you have any medical certificates, work cover or transport accident certificates, and any other information that you need before leaving the emergency department. Nobody chooses to come into the emergency department, and many times it's simply unavoidable. An accident, a sudden illness, or sports injury. However, many illnesses or injuries can be avoided or minimised by following a few simple lifestyle principles. Simple measures such as eating well and staying active can have a positive impact on your health. It's not always easy to do this, but your local doctor can provide you with some helpful advice and point you in the right direction. Examples of where your local doctor can help include screening for breast and prostate cancer. Prostate cancer affects 1 in 18 Australian men, and men over the age of 40 should be checked for prostate cancer every year. This disease is rarely talked about among men, but every man should be well informed. Breast cancer affects 1 in 12 Australian women. More Australian women die of breast cancer than any other form of cancer. Breast screening aims to detect the early signs of breast cancer when the treatment is most effective. Breast screening can be organised by your local doctor, who can give you more information. Your local doctor is there to help you stay healthy, and by having regular checkups, you can prevent many illnesses. Preventative healthcare is the answer. There are many other times in our lives where we're at risk of injury or ill health. At work, on the sports field, childhood injury or poisoning. In many cases, there are things you can do to prevent injury. Your local doctor or community health centre can help inform you of community resources available. It's important to remember that there are many highly qualified local doctors in your area, professionals that may already know you and have access to your medical records. These doctors are the best people to manage your ongoing general health care needs. They are also experts in many illnesses and minor injuries. On many occasions, they will be able to attend to your needs quickly and efficiently, avoiding the waiting that can sometimes occur in hospital emergency departments. Our goal is always to provide our patients with high-quality care as efficiently as possible. And if you do ever find yourself requiring our help, we are open 24 hours a day, every day of the year. The emergency department staff wishes you well as you leave our department and ask that you look after yourself and your family.